Next, I'm going to introduce our first speaker, who I'm really excited to have, who is visiting from South Korea, Dr. Sang-Hoon Lee. Dr. Sang-Hoon Lee is an upper extremity specialist in orthopedic surgery and has treated numerous Olympic athletes and conducted lots of research in regenerative medicine, including platelet-rich plasma. Dr. Lee?
Thank you, Stephen. It's a great honor to be here. And today's topic I will talk about is about lateral tuberculosis. But they say 10% you have to go through surgery, but is that right? I think that it's not. Through all my cases, when I retrospectively review all my cases, 10%, most of 10% was wrong diagnosis, but has the exact same physical exam and subjective feeling of lateral. Among the 10% of failed non-operative treatment, it's almost like, I think 80% of them, this is what we call patella-plica syndrome. Exactly same as patella-plica syndrome. There's synoviums inside it. So, like this. So when you pronate and flex your arm, we can find that in recent articles, none of articles is supportive to steroid. None. After like 2003 or 2004, where science has advanced, we know that lateral condylitis, pneumonitis is lateral condylosis. After that, most of recent articles are not supportive to steroid. Only short term, like 2 months, 3 months. Physiotherapy is pretty supported by. So what should appropriate treatment be? So I tried to search the appropriate treatment method, and my criteria was this. The treatment method should have healing potential. And should not make weakness of muscle. And should have low adverse effects. And there should be some. So let me talk about the shockwave therapy. Who use shockwave therapy in your clinic? Can you please raise your hands? Pretty small than I expected. Wow, this is very useful method. It's very easy. You can let other, like not doctors, you can let others do it. You're not going to waste your time. Very effective. This is very good tool. Then, and people here use bone therapy, like using dextrose or. So most of you people just use PRP, like you don't use it. This is a very cost-effective one. You just give the shot of dextrose. 0.05 points should be regarded as satisfactory. So I decided to hold treatment Olympics. Then my hypothesis was that one of the treatment group is better than control, which is physiotherapy. And among the treatment group, there should be some difference. That was my hypothesis. ECRD tendon is only that big. It's very thin. Ultrasound, I think you might have very high chance to miss it. So this was the result. It was very interesting. At 3 months, 6 months, there was no significant difference. But at 18 months, there was difference. Potentially, they're all related with growth factors. So this was my conclusion. Basic premise behind treatment method should be tendon healing in refractory lateral condylosis. I think recommended treatment should be recruiting or relieving growth factors and should promote healing, should have healing potential, and so protherapy and PRP should be the one should be recommended. Thank you.
Did you say that everyone should first have a trial of control therapy before considering PRP based on your studies?
Well, actually, you know, the score, PRP was higher, and my feeling, PRP is better. But this is, you know, research, so when we did statistics analysis, there was no difference between two. But when you ask me what you're going to do at the refractory cases, I'm going to use PRP. But, you know, these are not fresh cases. When it's fresh cases, we have to think about cost effectiveness. So I think growth therapy might be better. But refractory, when some patient came into your clinic and say that I did already some treatment, like physiotherapy or ESOT something, I have done it already, but it's not working, what you're going to do, then you have to heal that patient, no matter what. So I think PRP is recommended.
In any of your cases, did you do any post-treatment ultrasounds that?
Well, actually, I did, can you put this in? Unfortunately, symptom was great in PRP in follow-up, even after a year, but tendon didn't heal.